Hello everyone, my name is Seader, and the title of my presentation and poster is Rural versus Urban Drug Overdoses, Saving Lives One Person at a Time. So this is a copy of my poster that I have, and then throughout the presentation, I just have each section broken down, just so that way I'll be able to pinpoint more of the information and be able to explain it for all of you. So opioids are the #1 public health and public safety crisis. Drug-related deaths continue to increase post-pandemic, and I serve as a member of the Commonwealth Prevention Alliance Collegiate Action Network, also known as CPA-CAN, and our goal and mission is to work to create opportunities to engage campuses all across Pennsylvania around stimulant and opioid misuse prevention, and to also increase positive mental health, just so that way more students and also faculty and administration are aware of what we can be doing and what we can change to help not only our students, but also the community surrounding our campuses. So why is this research important? So rural southwestern Pennsylvania has an increasing rate of drug overdoses. As you can see, it's circled here as well. So where our campus, California's campus, lines right now, we're in the red area. So we're getting higher and higher every year with these overdoses. And that's definitely something that can be changed. So a couple of the research questions that I had is, why are there higher death rates with drug overdoses in rural areas in comparison to urban areas? The second question I had is, what can be done to increase accessibility of Narcan in rural areas, and what steps can be taken to decrease drug overdose death rates as well? So 97% of the PA counties report opioid deaths. So Narcan is a life-saving medication that can reverse an overdose from opioids, including heroin or fentanyl, and that's definitely something to keep in mind as well. And then PA has standing orders to authorize anyone to obtain Narcan. So whether that's getting kits or getting the training, just different things like that will definitely benefit and help not only our campuses, but also our communities, because we're able to provide more resources for these people. So rural access to Narcan is 41 to 47%, whereas comparing it to the urban areas and the cities, it's 92%. So that could explain why there's those higher numbers of overdoses in rural areas, is because they don't have access to Narcan. They don't have access to those resources like the cities and the urban areas do. So over time, opioid-related deaths continue to rise, and we definitely saw that especially after the pandemic. So in 2017 in PA, there was 43 deaths per 100,000, and the national average was 22 deaths per 100,000. And then in 2020, when the pandemic started, there was 4,314 opioid death-related deaths just in the state of Pennsylvania. And then 2021, 5,168 overdose deaths in PA, and in PA, that was 14 people a day that died daily from an overdose. And these numbers are just increasing year after year, and that's very unfortunate, especially to see in rural areas. So just kind of a cross comparison for both the rural and the urban areas. For the rural areas, there's higher rates occurring due to economic deprivation, and the emergency response times are greater for people to get there and to administer this life-saving medication, and just to be able to potentially help someone so they don't die. And then there's also lack of treatment facilities. So again, it goes back to that lack of resources and those decreased response rates not being as quick as they would be in other areas. And then for urban areas, they have the social programs. They have easier access to healthcare providers and first responders. Again, we saw that with the comparison where they had the higher rate compared to the rural area. And there's more easily accessible treatment facilities. And then similarities for both the rural and the urban areas. Costs, so out of pocket, Narcan ranges from 50 to 200 to $400 in 2017. And then again, lack of education. 1 in 3 overdose deaths have someone else present. So again, more of those resources. If we can provide more information about training, how do we get trained? How do we administer this? How do we help not only our fellow students, but also the people around us if we're to witness this, or if something happens like that? What can we do to help prevent that? And then fear of administering the drug to reverse effects of overdose. There's always going to be a fear played, but what can we bring to people's attention regarding decreasing the stigma around overdoses, just so that way, again, we're able to help a lot of these people involved. So then education. So action steps. What can we be doing? So in order for this to help, creating action plans and guides to follow, which will help students, faculty, and staff members. It'll also help the police, the residence advisors, and the community assistants, because if they're being trained, they'll know what to do. They'll also know who to go to if students have questions, or if anything happens, they'll know the correct people to contact and the correct people to direct them to. And then student leaders. You see your student leaders all around campus. Who better to be aware of all these action steps and who can share the resources with other students all across campus, because they can connect with them and people listen to them because they're the leaders they look to. So that includes student government, Greek life, athletes. If these people are more aware of and they have the training, it'll be really beneficial to our campus community. And then one of the resources that I found said measures such as expanding take-home Narcan programs, overdose response training, and pharmacist education could also save lives. So again, it goes back to implementing these action steps to help others. So availability, Narcan kits dispersed throughout campus with training for individuals to administer. And then the health center and counseling center working with students about options for prescriptions and health insurance coverage, because that can also help as well. Anyone can carry Narcan and give it to someone, experience an overdose, and potentially save a life. So again, just being more understanding of what we can do with our roles, and then how can we help those around us. So government support also ties in extremely closely to the action steps, because local and state legislators, they have resources, they have grants, they have information out there. And then pharmacist education and understanding of different policies, and then grant funding for our communities and our universities. So we're able to provide kits and we're able to provide the training for these students and for our campus community. Pennsylvania Overdose Information Network, or ODIN, is designed to provide criminal justice, government officials, community leaders, and policymakers reliable, real-time information to make data-driven decisions. And then another person is around when a drug overdose occurs 33% of the time. That's a really high statistic. So rural areas are seeing higher rates of drug overdoses combined with the limited resources. So again, they have less access to this, which is very unfortunate, because there's more people that we could be saving if we just provide that information. And then urban areas are also experiencing drug overdoses, but have more access to these drugs such as Narcan. And again, it goes back to education, and having access to Narcan are key to even the odds of help save someone's life. So what are some next steps? So planning to conduct an action plan at Penn West California as part of my honors thesis in fall of 2023, and to continue my work with CPA CAN, because it's really important and it can save a lot of people's lives, and also just help with that education factor, because every step towards that goal will help somebody. And then just working to educate campus, students, faculty, and staff while increasing access and availability to help save lives. So to break it down in 3 simple ways: educate, increase access, and save lives. Thank you so much for your time and your attention. And then I'd also like to thank Dr. Mark Lennon, who's my faculty advisor, Dr. Laura Tunerman, for my Honors 300 professor, Monica Ruran-Rogers, my research librarian, Strike a Spark / the Celebration of Scholarship Planning Committee for putting on this event and allowing students like myself to share our research and to also share important matters to us, and just being able to bring issues and things that we want to see changed to other people's attention, just so that way we're able to speak on a platform and connect with others, so that way we can implement our action plans and connect with more people, whether it's research or ways that we can help our campuses. So thank you again. If you have any questions, please feel free to reach out. Have a great day. And then the last slide that I have is my references. So this is where I got some of my information for my presentation. Thank you again, and have a wonderful day.